you.
Good evening. Thank you for joining us. There is obviously a shortage of vaccines that's being widely reported across the country. There are other problems as well. And I'm just going to go through some of the information that's coming today. From Gujarat, for example, there are reports of non-availability of beds in hospitals, no availability of the remdesivir injections, shortage of ventilators, shortage of ICU beds. This is in Gujarat, and it's being reported largely from Surat, but also cities like Ahmedabad, Vadodara, Rajkot, Jamnagar, Bhavnagar are also having problems right now. In Madhya Pradesh, in Indore, there is a shortage of remdesivir and oxygen. According to reports in the New Indian Express, authorities say they've asked for 7,000 doses of remdesivir. They're only getting half those numbers. They're attributing this to the fact that Maharashtra and Gujarat are facing problems, and so a lot of the Madhya Pradesh supplies are being picked up right now. Also, obviously, are the problems that are being reported as far as the vaccinations are concerned in Maharashtra, which is worst affected. Out of 120 vaccination centers that are operating in Mumbai, 70 were closed by the end of today because of a shortage of vaccines. The government has also said they're facing a problem in Satara, Sangli, and Panvel. Rajasthan has asked for 30 lakh doses, and of course, I told you the situation that's happening in in Gujarat. There have been other states that have also said that they're facing a shortage, or they may run out by in the next 2 or 3 days. So the question that we're asking right now is, why does it suddenly seem like we've lost control over the situation? Is it because of too many cases being reported? Is it because the second phase is more contagious or is spreading faster? What is the situation on the ground really? And to help me answer those questions, joining me right now is Dr. Mangesh Pate, who's always been very kind with his, and generous with his time right through the pandemic. He's agreed to give us time again today. Dr. Pate, thank you so much for speaking with us and answering our questions. My first question to you is about the shortage of remdesivir. How bad is it? Is it something that we should be worried about? Does it deserve more attention than it's getting right now?
Absolutely, Faye. Rather, I will say that it should be the only thing which shall be concentrated or attended right now, immediately. Because currently, the patients who are getting admitted to the hospitals, they are getting admitted with the moderate to severe disease. What was being discussed, say, around 10 days back or so, if you recall, when the second wave had just started, a lot of people were talking that this second wave is not as serious as it was in the first this thing.
Yes.
And
yes.
I had stated at that time it is not the situation. It is getting proved now. Today, we are receiving so many patients below 94 SpO2 saturation, breathless, and that is a stage 2B or 3 onwards, the disease. So people who are in the isolation or who are in the stage 1 of the disease, they are preferring to stay at home. First point. Second point, we do not have a hospital beds enough to admit those patients. We do not have enough of beds to admit even the moderate to severe patients. So hospitals admitting milder cases is out of question. So hospitals are admitting only moderate to severe cases, and as soon as these cases are admitted, what they need is the resource which only we have in our hand, that is remdesivir, and which is not available anywhere in the market. It is the most serious thing, and government needs to address this very immediately.
Doctor, what is the remdesivir used for? And why, for example, Madhya Pradesh said that they had asked for 7,000 doses of it. They've got half as much. Who's supplying the remdesivir? Where does it come from?
See, remdesivir is initially, when you were in the first phase, it was produced by HRO company. Okay. Later on, now almost 4 companies, they are producing the remdesivir. From various states, this production is coming. For example, if you check a HRO company, the main production in Gujarat is in Gujarat, and one of the southern state, most probably Hyderabad or somewhere. So from there, this supply is going all across the country. Now, my point is not which company is producing or how much they are producing or how much is the per day production in the country. My point is that when scientifically we were very much aware that we are going to face the phase 2 or the second wave of the COVID, it should have been the proactive preparation by the administration that this much of production and the stock of remdesivir must have been there. That is where we have failed miserably, and that is why people are suffering today. Now, when I inquired with all these companies, what I got to understand that at the end of the December or mid-January, when COVID was much controlled, the phase 1, the first wave of the COVID, that time this remdesivir production was slightly reduced quite a bit by all companies. But as the cases started rising and the second wave started approaching, they started again the production of the remdesivir. Now, according to the production facility, once they start producing this remdesivir again, it has to be in the balloon phase at least for 2 to 3 weeks. So when I inquired 2 days back, I have got the answer. By 10th of April or so, it shall be rampant in the market, or rather I will use the word adequate in the market, so that what people are suffering today, it may not be visible after say 2 days or 3 days time. And I'm just praying God for that.
What about the oxygen? We're also hearing reports from various places that we're running out of oxygen. Again, is this something that the administrations of various state governments perhaps should have prepared for, stockpiled, or it seems like they've been caught by surprise again?
100%. It is. There is no doubt about it. See, when we let me put it in a other way, when we are expecting from people that they should abide by the COVID appropriate behavior by wearing mask, abiding by the social distancing and hygiene. Similar fashion, there is something need for something called as the COVID appropriate administration, which we are not seeing from the start of the COVID pandemic itself. Now, when this second wave, which was imminent, not only these injectables like remdesivir, which are very much. Just now, I received a phone call for tocilizumab 5 minutes before starting this interview. Doctor Saab, I need tocilizumab. Immediately, patient is extremely critical. I called up 2-3 places. It is not available anywhere. Now, what relatives are supposed to do when they are not getting such critical emergency use medicines on time? And it is not something that doctors are going to anticipate that, yes, tomorrow evening this patient is going to need tocilizumab. No, it's not like that. Once we see that patient deteriorating very badly, that time we advise, now you get the tocilizumab for this, which is costing nearly 33,000 or 35,000 rupees the injection, tocilizumab. So this is something administration is supposed to have a foresight of this. And the stock of all these things should be there. As far as oxygen is concerned, let me assure you, today you are conducting this interview and asking me various questions for remdesivir. After 1 week, you will be asking me the similar questions for the oxygen supply also. Today's date, many parts of Maharashtra, there is a severe scarcity of the oxygen. One painful video which I saw one of the channels on the television today was from somewhere in the Nandurbar district, where when the truck carrying the jumbo cylinders of oxygen came in the hospital premises, government hospital facility I'm talking about, relatives, they were unloading the jumbo oxygen cylinders, and they themselves were carrying the jumbo oxygen cylinders to their near ones patients who were on oxygenation, who were COVID patients. That is something painful to see. So here, that's where the administration is lacking, and unfortunately, its onus is on me to open my mouth today. Usually, I don't.
I thank you. I thank you for being so forthcoming. We had also, at least in Maharashtra and in many other cities, seen a lot of temporary facilities that were set up for COVID treatment, which were given to understand were dismantled over the last 1 year. Are we going to have to, was that a problem? Should we have anticipated that we would need those extra facilities as well?
For COVID facilities, government,
Yes.
yeah, definitely. See, when the phase 1 of the COVID was on the decline, most of the facilities which were raised by government, they had intended or rather converted it to the vaccination facilities. And it
Yes.
was a welcome move, not at all the wrong move, definitely. But definitely those facilities, now they are opening up. But it should have been opened up slightly earlier. That definitely I will like to opine over here.
I have to also ask you, Dr. Pate, about the vaccination shortage. Now, I do know that it has been extremely politicized, and for me as a citizen and a journalist, I find that extremely disappointing also, because it's such an important issue, and we're not getting a straight answer from anybody. We're only getting political answers. But as someone on the ground who's tracking this situation, which I know you are, is this likely to be a blip of maybe 3-4 days and then the supply will begin again? Or have we miscalculated something? What is causing this shortage? Would you be able to tell us?
See, first is vaccination is something which should not have been politicized. Point number one.
Okay.
Not only now, when we propagated this vaccine, when we started this COVID vaccination drive, that time also it was politically motivated. Because why I'm saying this statement is very important, because of this political propagation of vaccination drive, it has given people a false feeling of complete safety. And that's why those who are vaccinated or those who are not vaccinated but about to get vaccinated, they have come at age as far as their behavior outside is concerned. Now vaccine is there, so nothing to be worried about. And that has put people to disobey the guidelines. And that has been the main reason for a spread of this second wave so fast. This is point number one about vaccination. Second,
Yes.
as you very appropriately asked, if once we start vaccination drive all across the country, the supply chain has to be intact. It has to be continuous. It has to be growing persistently. In fact, till 1 week back or so, we were discussing about increasing the vaccination centers all across. I had gone one step ahead and advised government that whichever vaccination centers are there, government facilities, they should open it 24/7. One more appeal I had made to the government, that instead of putting it to the only comorbid people or like recently 45 plus age group, they have opened it. I had suggested that open this COVID vaccination for every citizen of the country who is above 18 years of age. That will be more appropriate. More fast you do vaccination, because that is the only resource which we have to safeguard our own people. At least to some extent, we will be able to create some immunity amongst our people and decrease the severity or number of the people who are presently presenting us with the severe disease, that we can decrease. So it needs to be augmented very immediately. As far as this politicization is concerned, my opinion is that there should be no politics, but supply chain of the vaccine has to be proper, intact, and ever augmenting.
Dr. Pate, I want to compare us with the United States, for example, that is also manufacturing the Moderna vaccine. They have not exported a single dose. The United States has exported a total of 0 doses. They have kept all the doses for themselves, and they said that we will first look after our citizens. Now, that's one way to do it. The other way to do it is what we have done now. As per the information from our health minister, our union health minister, we have exported 6 crore doses. Across 6.45 crore doses. And just as of today, we've gifted 1 lakh doses to the Bangladesh army. Now, again, these are 2 different routes to take, and it's up to the government to decide which route they were taking. But was there a challenge here in just planning of how many would be needed, how they need to be manufactured, how they need to supply? Because state governments are now saying we'll run out in 2 days, we'll run out in 3 days. The central government is saying, don't worry, it's in the pipeline. So how are we to understand this shortage? Is it a shortage that will likely last for a week and then come back? Or are we manufacturing less? Did we export so much that we have nothing left? We don't know what to make of this.
See, the decision of the exporting the vaccine is totally under the ambit of the union or central government. Point number one. Point number two, when someone takes such a decision, they have to ensure, or let us hope that they must have ensured that we have got adequate vaccine inoculation dosages, which will be sufficient for all the states in the country. And if, third point, if after that some states are complaining, or even if center is answering to the states that it is in the pipeline, then there may stand some objection to the export, definitely. I will not be in favor of export, even if it is a retrospective, still, then it becomes a questionable thing. So unless we have entire data of the production, what is the situation when the decision of the export was taken, we will not be in position to comment upon anything. But if the answer is coming to the states or the people of the country that the vaccine is in pipeline and very soon this shortage we can overcome, then the decision of export, it stands in the bracket of the question.
Mm. Also, we had the central government respond to states, and you said yourself that you had advised that everyone above the age of 18 be vaccinated.
Yes.
The central government said that our aim is to vaccinate those who need it and not those who want it. Now, again, there are two arguments here. We have the state governments who are arguing, listen, we have to stop business. We're putting lockdowns. The larger working population is 18 to 45. If we vaccinate more people, we will be able to allow them to move around. But what is your response to the government saying that we are only going to give it to those who need it and not those who want it? Could you help us understand that a little bit?
This is a question of a prioritization of the vaccine. And I agree that people who are having comorbidities, they should be covered first, no doubt about it. But as a principle, we can definitely open this vaccination for everyone who is 18 years and above. And this prioritization for the comorbid people, that is a definitely administrative protocol which can be prepared by the government. You can have, whether suppose I have a diabetes mellitus or hypertension or any other comorbidity, I have to produce the certificate by the physician. Some evidences that I am having such and such a comorbidity, and my number can come above in the priority list. But it does not mean that we differ from the decision of giving vaccination to entire population who is above 18 years of age. It should not stand in the way of deciding this policy. This is the important. These are the two separate things.
Right. That's a fair point. I also want to ask you right now, in terms of the vaccination, the question that has arisen among a lot of audience members is this: we were asked initially to take the 2 doses 4 weeks apart. We were then told to take the 2 doses ideally 6 or 8 weeks apart. Now the question that people are asking is, was the motivation behind the increased gap between doses because there is a shortage, or is there proper scientific evidence to suggest that the efficacy goes up?
No. I will appeal everyone not to jump to such a conclusion. Basically, when you launch vaccines, now when you go to the phase 4 of the clinical trials, when you start understanding the immune response of the vaccines. Now, if you see, when India launched this vaccination, government of India launched this vaccination, that time already this vaccination was going on in the European countries and the United States of America. And if you recall, their Pfizer vaccine, they had put 2 dosages at the interval of 4 weeks. But later on, when we started vaccination in India, at that moment, they announced that 2 dosages of the Pfizer vaccine will be placed at the interval of the 8 to 12 weeks. We are saying 6 to 8 weeks now. They said 8 to 12 weeks at that time. It was not because of the shortage of the vaccine. Even in United States, this point was discussed among the population over there, whether it is because of the shortage of vaccine, but it's not like that. It depends on the immune response. Now they are saying, if you space the 2 dosages instead of 4 weeks, between 6 to 8 weeks, we may get a better response after the second booster dose in population. That's why they are trying. That tomorrow, don't get amused if government plans that 2 dosages should be at the interval of 8 to 12 weeks. There will be no bad motive behind that. It entirely depends on the study of the immune responses in the phase 4 clinical trial. It is related to that, not to the vaccination shortage or something.
There are a lot of people, Dr. Pate, who have received their first dose and are now worried that they'll not get their second dose because of the shortage.
We all will not be in a position to answer this question in the current situation, because right now, I will say 25 to 30% of vaccination centers, they are not working today's date. We are just hoping next 3 to 4 days they all will start working again. And if it does happen so, there should be no point of worry for anyone who has received their first dose. They definitely will receive. According to the software which government of India is working upon, the one who receives the first dose is supposed to receive the SMS for the second dose automatically. So let us hope that thing will again come back to the track once this supply chain recovers from whatever slumber it is right now.
Also, Doc, we have a lot of understanding now in the second phase that we didn't have in the first phase. For example, I see, for example, people coming in to collect samples for the COVID RT-PCR test are not wearing a PPE anymore. They're just wearing a mask. Is that laxity? Is that a clearer understanding? Is there pressure right now on our testing facilities as well, like we saw happen last year around this time?
It is very wrong if it is happening. And I received this, I heard this from few of other sources also. But those who are coming for the collection of the swabs, may it be at the home or at the hospitals, whatever, they should be in PPE, first thing. Second, they should undergo their own RT-PCR very at regular intervals. That is very important because they are the one who are coming in very immediate contact with your nasooral mucosa, and it is always better to take care. They should also be wearing mask and face shield at the time of collection. That should not, we should not waive off from that protocol.
And doctor, there was also some, articles that were written about the fact that this time there is a clearer understanding that the COVID is not transmitting through surfaces like we thought last time, like door handles and things like that. It's mostly from breathing, when people stand across from each other. Is that true?
To some extent, yes. There are few papers which are published, and they are slightly not giving that much importance to the surface transmission of the disease this time. First thing. Second thing is that as we see, there is a difference in the strain what we are seeing in the second wave and the strain which we were used to see in the first wave. There is a lot of difference. As far as symptomatology is concerned, there is a difference. So similar way, this surface thing, they are slightly not very much giving importance, but definitely I will like to make it very clear over here for our general population and everyone that be very hygienic, even surfaces, keep it clean. That is better.
So when you say the symptomology of the second wave is different from the first wave, and I want to combine that with the question of the fact that initially people told us in this wave, it is more contagious, but not as deadly, less fatal, more contagious, less fatal. Is that something that you buy into?
See, I'm not exactly saying that, but definitely what you say is absolutely correct. I will use the word infectivity rather here. The first strain, it was less infective. This strain is more infective. Example is that now, if you see one person from the family gets COVID positive, within 24 to 48 hours, you can see entire family getting positive, which was not the case when the first wave was there. One or two people from the family used to be positive, and other people used to be healthy and hearty. They used to come negative during their contact tracing. But that is not the situation right now. So infectivity of this strain is much rampant, much higher as compared to the previous one. First thing. Second thing, your second part of the question was whether it is less dangerous, something like that. I am definitely not of that opinion. Yes, symptoms are slightly different than the first wave, but it does not mean it is less dangerous. I told you in the beginning of this interview, we have started receiving patients with the 70 and 80 saturation very rampantly. They are becoming bad. So please do not take it lightly. The symptoms which are added in this second strain, which was not seen in the previous strain, was the abdominal symptoms, that is the loose motions, abdominal pain, headache. Now patients are coming, many of patients, COVID patients, without any history of fever, without any history of cough. They are coming only with the loose motions and pain in the abdomen. And when you do RT-PCR, it is coming out to be positive. So this is a new added symptom Even WHO has said in their protocol mentioned about this new symptom, but it does not mean that respiratory symptoms have gone down. Patients are definitely coming with the COVID pneumonia and very low SpO2.
Also, Doc, the idea that younger patients or younger people might get it, but will be asymptomatic, will isolate, will be fine. It's okay. Don't worry about it. Is that something that is fair? What is the average age? Or are you seeing young people come in with severe
I
symptoms?
never saw children during most of the 99% times. I never saw children during the first wave of COVID. But right now, last 1 month, I have seen so many children. Even 10 months old child, I have seen positive. Children are getting affected because of COVID this time. This is another thing which I forgot to mention here, and people have to take care of their children definitely. This time, more and more children are getting affected. This trend. Yes.
And getting infected and showing symptoms and getting hospitalized as well, doctor?
Yes, few of them are getting hospitalized. Few of them are getting remittent fever and other symptoms. But yes, respiratory symptoms, what you see in adults, they are not seen in pediatric population as much. But the positivity rate is definitely much higher than what you saw in the first wave.
What about adolescent and young adults? So people from the ages of 16 to 35, are they also falling sick? Or are
Yes,
they?
100%. Say 25 to 30% admissions, they are from 25 to 35 years of age group. They are getting affected. 100%.
The question that keeps popping up, and I'm going to have to ask it because people are asking this question. We're getting a lot of reports, including in Delhi just today. It was carried extensively by news channels who continue to do that disservice, that there were a certain number of doctors in one hospital in Delhi who all tested positive for COVID in spite of receiving both doses of their vaccine. It still seems to be a misunderstanding among audiences that you will not test positive after getting the vaccine. Do you want to clarify that one more time for us, please?
I will put forth your question in a very different way. It has been asked by many people that I have taken both the dosages of vaccine. Still, after a few days, I became COVID positive and got affected by COVID and got admitted, and I'm undergoing treatment. This is the question exactly what is being asked. See, when you receive the two dosages of the COVID vaccine, it is a variable response in body, how much antibodies will be produced in your body. First thing. Second thing, even if you receive both the dosages, it takes 1 to 3 months of time for development of an antibody response in your body. So there are many patients who are coming that I had taken second dose of vaccination just 4 days back. I got a fever, or after receiving second dose, I started getting fever, some pain in the arm, but that fever continued. On day 4, I did the test, it came positive. It is not because of the vaccination, but definitely patient has come in contact with some COVID and he has got the COVID from there. Point here is that COVID vaccination immediately does not give you immunity against the COVID. Immediately, I am saying. It takes a time for development of the immune response in your body. And second and last point about this is that in spite of you taking vaccination, you should never forget the COVID appropriate behavior. That is for sure.
I beg your pardon, my dog was barking, so I had to mute it. So obviously, there's another question that has come in where someone has said that if I've taken one dose and then I test positive for COVID, is the second dose then of any use because I have antibodies in my system now already generated from the infection?
If first dose and you get COVID, antibody response due to COVID, which is happening, it usually starts after 28th day of the infection. 28th day of the infection. And the dosage interval between your first dose and the second dose is 1 month as far as the prevailing conditions are concerned. Right now they are suggesting 6 weeks or something, but not yet applicable. So if you receive first dose and you receive you catch with the COVID and you are about to develop, obviously when you are having COVID actively, at least next 2 to 3 weeks, you are not going to get the second dose. And so 28 days down the line, if your antibody response is high, you should not go for second dose immediately.
All right, Doctor, I'm going to leave it there. Thank you so much for answering our questions so patiently. Just to wrap it up for our audience who might have joined a little later, one of the most severe problems the country is facing right now is a shortage of remdesivir and a shortage of oxygen. There's also a shortage of beds. And unfortunately, all of this is leading to a pile up in crematoriums, which is now being reported in several states. So the doctor appealed that the governments, all governments at this point, all administrators, state, city, center, pay attention to the shortage of oxygen and the shortage of beds. And of course, that will lead to a shortage of ventilators as well, which we saw happen a year ago, which we seem to have not learned from, unfortunately. As far as the shortage of vaccinations are concerned, we're hearing reports from various state governments, but we're not hearing any clear answers from anybody because all of the communication around vaccines right now is completely muddled and the waters are muddied by politics. So nobody's giving us a straight answer as to what is causing this shortage, how long it will take to sort it out, where is this extra doses going to come from? We don't know. So unfortunately, nobody can really answer those questions at this point, except governments, and we're not getting clear answers from our government. In the meantime, I do advise anyone who's joined us right now to watch. It's a 30-minute conversation. Watch this conversation again for all of the advice on how to manage, look after yourself and your family during this second phase of what can only be described as a highly transferable or contagious version of this virus, and something that's still dangerous. So we cannot afford to take it lightly. Dr. Mangesh Pate, thank you for your time and thank you for answering.
Thank you.
For our audience at 9 o'clock, our news will be up. Just the news. Remember, no opinion, only what has happened today. That's up at 9 o'clock. Do take a look at it. Subscribe, like, share the videos on our channel. Thank you so much for watching. Good night.
Thank you.